Hello, this is my Pillar 4 Arterial Concepts Relate token, improved. So I'll be talking about how Marfan syndrome relates to the concepts that we've discussed in class about the arterial system, and more specifically, aortic aneurysms. So Marfan syndrome is when there's a defect in the gene that enables your body to produce a protein that helps give connective tissue its elasticity and strength. Marfan syndrome can damage the blood vessels, heart, eyes, skin, lungs, and the bones of the hips, spine, feet, and rib cage. It can cause the walls of the aorta to become weak, causing enlargement to occur. In other words, an aortic aneurysm. On the left, you can see a normal heart, and you can see on the right someone who's suffering from Marfan syndrome, and you can see the enlargement of the aorta in the comparison. How does this relate? Well, you can see on the left, as I discussed in my understand token, this is the mechanical representation of the Windkessel model. And when blood flows from the left ventricle through the aorta to the arterial system, the weakened walls of the aorta allow for greater expansion of the vessel. In other words, the aorta has a greater compliance, meaning a small increase in pressure causes a large increase in volume. The enlargement most commonly happens at the aortic root, so where the artery leaves the heart. You can see this in the diagram. This is the aortic root where it leaves the heart. You can see it's much larger than it is on the normal heart. So blood vessels throughout the body are affected, but blood pressure is highest as it leaves the heart through the aorta and gradually decreases as it enters smaller and smaller blood vessels such as arteries, arterioles, and capillaries. So the increase in compliance of the aorta is most significant and potentially most life-threatening. Some additional comments are just other cardiovascular related issues that are found in people who suffer from Marfan syndrome. So you can have aortic dissection, which is when the aorta tears and leaks blood. You can have mitral valve prolapse, which is when the valve is unable to close properly. And you can also have aortic and mitral regurgitation, which is when the blood flows back through the valves. And so aortic dissection causes aortic regurgitation, and the mitral valve prolapse causes the mitral regurgitation. Some individuals may also develop pulmonary artery dilation, which is the widening of the main artery of the lungs, but that usually doesn't cause too many problems. Some treatments of Marfan syndrome include medications to keep your blood pressure low to reduce stress on the aorta. It is also not recommended to do any sort of extensive physical activity because that puts a lot of stress on your heart and your aorta. It's also not recommended to become pregnant because that also puts a larger stress on your heart. Yeah, thanks for watching.